Clinical Pharmacology for 6th semester students of the Faculty of Medicine. 1. Advanced Pharmacokinetics and Pharmacodynamics. Pharmacokinetics. Pharmacokinetics studies how the body affects drugs, absorption, distribution, metabolism, excretion. ADME, absorption, distribution, metabolism, excretion. Factors that affect pharmacokinetics include age, infants, children, elderly. Organ function, kidneys, liver. Drug interactions. Half-life and steady-state concepts. Example: a drug with a short half-life, such as paracetamol, requires more frequent dosing compared to digoxin. Pharmacodynamics. Pharmacodynamics discusses how drugs affect the body, including drug mechanisms of action and the dose-response relationship. The relationship between drug concentration and therapeutic effect. Receptor binding, agonists, antagonists, and allosteric modulation concepts. Dose-response curve, the relationship between dose, maximum effect, and side effects. The therapeutic window concept, the range between an effective dose and a toxic dose. 2. Rational drug use. 5 rights principle. The right drug, the right dose, the right route of administration. The right time, the right patient. Drug selection is based on effectiveness, safety, side effects, contraindications, availability and cost, cost-effectiveness principle, evidence-based guidelines, such as WHO Model List of Essential Medicines, national guidelines, e.g., Treatment Guidelines for Infectious Diseases in Indonesia. 3. System-based pharmacotherapy, cardiovascular, antihypertensive drugs, ACE inhibitors, ARBs, diuretics, beta blockers. Heart failure treatment, digoxin, spironolactone. Coronary artery disease therapy, nitrates, aspirin, statins. Respiratory, asthma treatment, bronchodilators, salbutamol, inhaled corticosteroids. COPD therapy, combination of bronchodilators and corticosteroids. Endocrine, diabetes mellitus, insulin. Oral hypoglycemics, metformin, sulfonylureas. Thyroid disorders, levothyroxine, propylthiouracil. Gastrointestinal, gastroesophageal reflux disease drugs, antacids, PPIs, omeprazole. Diarrhea treatment, oral rehydration solution, loperamide. Infections, antibiotics, classified by mechanism of action, beta-lactams, macrolides, aminoglycosides. Antifungals, ketoconazole. Antivirals, oseltamivir, antiparasitics, metronidazole. 4. Treatment of infectious diseases, empiric therapy versus targeted therapy. Antibiotic selection based on spectrum. Broad spectrum, carbapenems, versus narrow spectrum, penicillin. Antibiotic resistance. Causes of resistance, such as irrational use of antibiotics. Antibiotic stewardship strategies. Administer antibiotics according to guidelines and patient needs. 5. Drug side effects and toxicity. Drug side effects, allergic reactions, rash, anaphylaxis. Specific effects, such as hepatotoxicity with paracetamol or nephrotoxicity with aminoglycosides. Drug toxicity, therapeutic index concept. Overdose management, paracetamol, antidote N-acetylcysteine. Opioids, antidote naloxone. 6. Drug interactions, pharmacokinetic interactions. 450 cypriot pounds enzyme inhibitors or inducers, e.g., cimetidine as an inhibitor. Pharmacodynamic interactions, synergism, combination antibiotics, e.g., amoxicillin and clavulanic acid. Antagonism, NSAIDs reducing antihypertensive effects. 7. Drug use in special conditions, pregnancy and lactation. Drug safety classification, FDA categories AX. Example, Category D drugs, such as phenytoin, should only be used if the benefits outweigh the risks. Pediatrics. Dose adjustment based on weight or body surface area, BSA. Geriatrics. Changes in drug metabolism due to declining kidney and liver function. Kidney and liver disorders. Dose adjustments in renal or hepatic failure to prevent drug accumulation. 8. Rational prescription principles. Complete prescription components. Patient identity. Name, age, weight. Drug information. Generic name, dose, quantity, route of administration. Example prescription. A 10 kilograms child with fever. Paracetamol syrup 250 milligrams, 5 milliliters. Dose 10 milligrams per kilogram every 6 hours. Administer 1 milliliter per dose. 9. Pharmacogenomics. Genetic response to drugs. Example, CYP2C19 gene polymorphism affecting clopidogrel metabolism. Genetic-based individualized therapy, personalized medicine. 10. Evidence-based medicine, the PICO principle for literature searching. P. Patient or population. I. Intervention. C. Comparator. O. Outcome. Assessing drug effectiveness and safety based on clinical trial data. 11. Clinical cases, case studies. Patient with uncontrolled hypertension despite ACE inhibitor use right-pointing arrow add diuretic therapy. Child with urinary tract infection right-pointing arrow antibiotic selection based on urine culture. Analysis exercise. Identify the main problem. Recommend appropriate treatment. Monitor side effects and therapy outcomes. Additional. Visualizations and tables, diagrams and graphs, dose response curve. Drug mechanism of action diagram. Supporting tables. FDA pregnancy category table. List of half-lives of important drugs.